So today I'm going to talk about getting a research question and then also moving through to talk a little bit about title and aims and objectives. So things to think about when writing, coming up with a research question. So you need to think about what criteria is your question going to be judged upon. And then also think about how to articulate the question. So ideally that needs to be articulated in a single sentence. So just moving on to think a bit more about, what criteria would my question be judged upon. So what we're looking for is evidence to sort of talk about what the problem is. And when you write a grant application, you need to write a background section, and you need to write all of these things into your background section. And you need to make sure you can answer all of these questions, and then it's likely that your research question you want to answer is likely to be competitive. So the NIHR will be looking for how bad's the problem, what don't we know about this problem, what's out there that might help to make the situation better, will what I do make a noticeable change to patients and to clinicians, and is there anyone out there who's also supporting this work to be done? So it's not just my bright idea. Are there other organisations or other people out there who would also think that this is a good idea? And if you can answer all these questions, it's likely that you can pull together a competitive research question and therefore a competitive grant application. When thinking about that research question, it's really important to think about if there's any specific criteria that a funder's interested in. So for example, NIHR are generally interested in funding projects that can make a short to medium term benefit to patients, the NHS or social care. And then in addition to that, each funding stream has got its own set of priorities which you need to address when applying to them. And if you're applying to outside of NIHR, so again, charities will also have their own their research priorities they want to fund, and so do the medical research councils for UKRI. So it's really, really important to look at the guidance, whatever fund you're going to, and make sure that you can address those priorities for that funder. And there's generally general guidance as well around completing application forms. And so I suggest looking at that as well, because it really pays to understand what the funder is going to be looking for in the application, because that will help tailor your research question and also your aims and objectives that follow it as well. So let's take a little bit of time to think about how we might start to come up with a research question, or the things we might need to do to think through to make sure that it's an important question. So the first thing to think about is kind of how bad's the problem. So what's the scale and what's the impact? So this is a number of people affected. It's also, so that could be a large number of people and therefore have an impact on lots of people. It could be a really small number of people because it's a rare disease, but by changing the care for those people, it could have a really, really large impact. It could be an impact on carers. It could be an impact on the NHS or on the social care system. And it's likely to have an impact on costs for those as well, either as people as individuals or as the NHS or social care system as a larger entity. So really important to think about that scale and size of the problem and the impact of the changing it's going to have. So then let's think about the need for evidence. What do we know? What don't we know? Really important to work out what the evidence gap is. So look at literature, work out what we know, work out what we don't know, and then think about how your research question is going to answer that evidence gap. And we talk quite often about it being a bridge that links what we don't know and what we do know, and then your research to use a bridge that's going to link the two. And that can be a helpful way to think about it, but be really clear what the evidence gap is and how you're actually going to address that evidence gap through your research project. It can be helpful maybe to use a logic model. So that might help to think through why this intervention might work and also the need for evidence. So the intervention could be anywhere along this logic model. And then it can help think, where the problem exists, and also it thinks, the cause, and by changing it, how that might have an impact. So logic models can be really, really helpful. And I think most funders can let you include a logic model if that's helpful in your application to explain the situation when applying. So you can think about including one if that's helpful for you, but you don't have to. Let's think about the need for evidence. So by doing this study, will there be a noticeable change? So, for example, are you targeting a reasonable proportion of the population? Are you targeting maybe a minor cause or a major cause of the problem? If it's sort of an early stage project, once it moves forward and you develop it further, will the problem, we make a notable change to the problem? How are you going to quantify the need for evidence? How have you identified it? So just thinking about the impact and the change that your project's going to have, and quantifying that's really important as well. So this is about the need for evidence, and it's generally about getting some enthusiasm amongst people who might not know your area. So when applying to NIHR in particular, but also other funders as well, there might only be one person on the funding panel who really gets your area of work. The rest of the funding committees are likely to be from other disciplines or methodologists or PPI experts, and therefore they won't really understand your area of interest. Generally, people are very excited about their own research question, their own research, but you want to demonstrate that other people out there are also interested in your area. So a way that you can do that is talk to other clinicians, talk to carers, talk to health professionals, talk to social care workers, talk to patients. How can you make what you want to do stand out? Do other people agree with you? This is a really important area of work. So we're talking to those, you can get support from other people. You could also look at national organisations to make yours stand out maybe from some of the others that are in there. So, for example, NIHR's got a number of strategic priorities and areas of interest. You can look at those. Does your area of work align to one of those? Look at NICE guidelines. So NICE make research recommendations in every single piece of guidance they produce. Does your research question, your area of interest, answer one of those research questions which NICE has prioritised? If it has, reference NICE guidance, reference the NICE research question. Think about the James Lind Alliance. So I don't know if people have heard of the James Lind Alliance, but they are an organisation that brings together clinicians, the wider public and researchers together to work out uncertainties in particular areas. And they're generally quite broad, so they generally produce a top 10 uncertainties, and they can be really, really broad uncertainties. But they can be also be really important to looking at to see if your work will start to answer some of those uncertainties. And you can reference a James Lind Alliance priority setting partnership. Look at the wider literature, look at charities, look at professional bodies, look at patient groups. Are they all also calling for research be done in this area? If so, it just adds weight to your field that you're trying to work in. We're going to move on now to go through a worked example so we can see how you might take a piece of guidance and how you might start to think about how you could do your own research on a piece of guidance. So we are going to use an audit from the National COPD Audit Programme, and this reported that the uptake of pulmonary rehabilitation was only 69%. The report highlighted that this was an area worth exploring, and what they were really interested in was, can we improve this uptake? So this was a report done by the Royal College of Physicians, and starting off, we checked to see if there were any relevant NICE guidance or any research recommendations made by NICE. We know that by looking at NICE guidance that it is part of the patient pathway to refer COPD patients to have this rehabilitation in certain instances. So therefore we know that it is really important to understand how we can improve uptake and how patients are referred to this rehabilitation programme, and therefore that's why we want to explore further. So we've done the first bit, we're checking NICE guidance, we know NICE recommend it, so we need to actually understand why patients are taking this up. So let's do a little bit more digging around the ideas. So next thing I'm going to go and do is I'm going to go and talk to patients. When I talk to patients about why they're not taking up this referral offer, patients tell me that when they turned up, it wasn't quite what they expected, and the expectation didn't reflect reality, and therefore they dropped out or didn't want to continue going. Other patients tell me that they didn't know what to expect and therefore didn't want to go because it's too uncertain. So then I have a chat with some clinical colleagues and I find out, why they think patients aren't taking it up. So my clinical colleagues said they didn't really understand. And what they say is they were just worried about the impact of wasted resources and missed appointment time. And they really, really would like to investigate why patients don't take it up, because they know this is a NICE recommended treatment and therefore they know it will have impact on patients. So got 2 points of view there from the broader community, both from a patient view and a clinical view. So I got thinking about kind of what we could do to think about this, and I'm wondering that although it's not a primary driver, maybe there's something we can improve in the referral process as to improve, patients' understanding of what was going to happen to them when they're referred, and set out the reality of what this was going to be at the when they actually started going to their rehabilitation sessions, so they could understand more what was going to happen. So based on that, it wasn't necessarily the starting point, but I've changed it based on where I've got to by talking to colleagues. So I feel like there's a good question here that needs answering. So I need to know a bit more about kind of why some patients go along, why some patients do go along, and to understand that process a bit more. So going to do a bit more digging. So I'm going to speak to a bit more consultation with patients and stuff, and a bit more clinicians. So when I find out I speak to clinicians, they're a really broad group. So there's some GPs referring people, there's practice nurses, respiratory consultants. They're all based in different settings or different strains on what's happening, but they've all agreed that encouraging some behaviour change in patients might be really beneficial, so that they can understand why they're being referred and what to what to expect when they get to their appointment. So I've decided, based on all these consultations, what I could start to do was to target the role of the pulmonary rehabilitation services, and they're the people that make contact with the patients, and also understand a bit more about the referral process and the information that patients are given. So what I find out is that through consulting literature is that 88% of the services actually send out written information to patients. They don't really get any more information. So there's not a lot of information given to patients. I also find out from my literature review that generally COPD patients are associated with a lower health literacy, and there's no gold standard information given to patients. So I'm wondering if the information given to patients is actually sufficient, and wondering maybe there's something else we could do at that referral point so that patients get more information, have a positive experience about understanding what they're being referred to. So piecing that together, there is a lack of understanding about the benefit, and there's a lack of understanding about what they're going to. So by my literature review, I have come across something called motivational interviewing, and I'm wondering if this is a tool that could help people. So in other areas of research, it's been used, and it's been shown to be a useful method to improve engagement, improve attendance. And although there's limited work for respiratory populations, I'm wondering if this is a tool we could start to use to actually motivate people to want to attend their appointments, and whether there are mechanisms that we could use this to work in this situation, given that I've also found out that most referrals are through letters and there's no common way of referring people. If we can just give people a bit more information, that they might improve attendance. So let's think about developing that idea a little bit further. So what we found so far, so we found out that there is a lack of perceived benefit of attending their rehabilitation referral. We've found that there's a lack of information for patients, and reality doesn't quite sort of reflect what they're expecting. And we know that clinicians are concerned about patients missing out on a NICE recommended treatment, and we know that some patients have gone for a first appointment but not gone for more because it wasn't what they expected. And we found out that most referrals happen through letters, and therefore there's not that engagement through their clinician encouraging patients to go. So we found out that there's potentially a question here where we could start to address improvements in sending people for their referrals, and hopefully if they understand better, they might actually turn up more and they might get some benefit out of going along. So that's kind of how we developed our idea and how we started to get a research question by searching literature. So let's go back to the first slide where we talked about kind of the things we need to address to make a really strong case for the research. So the first question was, how bad is the problem? And this we've described now in terms of benefits of promoting rehabilitation and to the extent it's not being taken up. So we know it's beneficial, nice to say it's beneficial, but we only know 69% of people are taking it up. So really bad that only just over 50% are taking up this treatment. We know it works. So it's a problem that people aren't taking up beneficial treatment. So we've got quite a good case there for how bad the problem is. What we don't know if a motivational interview is going to be a tool that's going to help at all, but we know it works in other situations. Therefore, we think it might work. So therefore, we know what we don't know, and we also know how it might work. So we've sort of answered both those questions. Will it make a notable change? Hopefully, yes, because people will take up their NICE recommended treatment, and therefore they should hopefully see improving symptoms. So hopefully it should make a really big change to lots of people. And who's calling for this work? Well, we've got the report from the Royal College of Physicians and the COPD audit. We've spoken to clinicians. We've also spoken to patients. We know everybody's calling for more help in this area. So we've got quite a strong case to show that this research is needed. So how do we start to think about our research question, and how do we start to shape that? So basically what we're trying to do is, does motivational interviewing improve the uptake of pulmonary rehabilitation? That's kind of the nugget of what we're trying to do. But can we refine this question to be clear about what we're going to investigate in this study? So we need to remember that most people on the committee won't know what we're investigating. They won't understand the details of our area. So we need to think about, can we be clearer about what we want to do? So I have highlighted the word improve, so that's really clear here. So does motivational interviewing improve? So this is what we're trying to do. So we're trying to improve the uptake of pulmonary rehabilitation, so that sort of highlights that. What are we comparing it to? So are we going to compare it to usual care, where people just get a letter in the post? Probably. So we probably need to include that as well, so that you can see that we are comparing against something that we currently do. So here I've included the word usual care. And then the next bit is I've highlighted the word does. So what do we mean by the word does? Can we be a bit more explicit around what does motivational interviewing do? So we could change that to be, what is the effectiveness of motivational interviewing compared to usual care in the uptake of pulmonary rehabilitation? So it really highlights all the sections, the things that we're going to cover in the study, and really demonstrates to the people reading the application that we're looking at effectiveness. So does motivational interviewing work? So that's effectiveness. We are looking at our intervention, which is the motivational interviewing. We're comparing it to usual care. And so it sort of really guides the reader through exactly what we're going to be doing. And you've probably heard the word PICO a lot in the past. Basically what we've just done is worked through the PICO. So we have included the population in our research question, we've included our intervention, we've included our comparator, and we've also included our outcome measure. So it's really clear what we're doing right from the start. PICO doesn't work for everybody. I'm not going to go through all the alternatives in lots of detail, but just say there are lots of alternatives out there. So for example, there's PICO, which is to use for an observational study. There is CCP, which is looking at studies that may not have an intervention identified, and it could be looking at prevalent studies, that kind of thing. So that can be used in this instance. SPICE is one you can use if you're doing qualitative research questions, and there's lots of others out there. And you don't have to use these frameworks, but they are quite helpful in just starting to frame your thinking in a clear way, which is understandable to people outside your fields. So you'll be able to see the slides later as well, so you can get the details of these out the slides if they're more relevant to your study than a PICO framework is. So moving on to an aim. So you've kind of got a research question, thinking about an aim. You might not need to include a research question and an overarching aim. So you might want one or another. You don't have to have both. They both kind of do the same thing. They're just outlining in simple language what you're going to do in a study, and hopefully in a single sentence. If you preferred aim over research question, go with an aim. It basically says exactly the same thing to the research question, and you can easily turn a research question into an aim. So an aim just tells basically what the study is about and what it hopes to achieve. And all I've basically done is the aim is to investigate the effect of motivational interviewing compared to usual care on the uptake of pulmonary rehabilitation. So kind of exactly the same thing. It doesn't need lots of detail. It's just a reference to what you're going to do. It's not about the how you're going to do it. It's just outlining the study in a single sentence rather than a single question. And then once you've got an aim, you can move through to objectives. So the purpose of the objectives is to break down kind of how you're going to do the aim. And the language should be sort of fairly straightforward. It should be conceptual rather than methods. So this isn't about the details of the analysis tools or anything like that. That's that details for the project plan, the application. This is kind of the bones of the project. And then when you move through to the project plan, that's where you sort of add the meat onto your objectives. So they should be capturing the major milestones or the components within the study, so the reader is kind of prepared for what's coming in the project plan. So for an example, if you've got a nested qualitative study, you want to highlight that in one of your objectives. You can normally add a little bit of discussion into the aims and objectives section. So you might want to provide a little bit of rationale for some of the objectives. It's not clear from the background. So for example, using that qualitative example, again, if you had a nested qualitative bit in your study, you might want to say, we're using qualitative methods to better understand how to implement the intervention into routine practice, but you're not going into lots of detail. That is for later on, but you can include that little bit of rationale should you think it's beneficial, but you want to keep them quite short and sweet. So then just looking at what you may or may not include in your objectives, you kind of want to orientate people for what's coming up in the project. So for example, an objective shouldn't be to randomize. Randomizing is kind of what you're doing to allow you to assess effectiveness. Is not an objective. Recruiting people is not an objective. That's just what you need to do the study. If you're doing a qualitative study, that is an objective because that should be included. If you're looking at effectiveness or cost effectiveness, they again are major parts and they should form part of the objectives. So it's just about sort of priming the reader for the major parts of your study and what to expect as they start to move through in the application form. So objectives. So in this example, we've gone for refining face-to-face motivational interviewing, gone for determining the effectiveness of motivational interviewing, assessing the fidelity, exploring acceptability, and then the potential barriers as well. So they're the key bits that we want to look at in detail as we move through into the research plan. They're the major aspects of the study. They don't talk about the detail of how we're going to do it at this stage. So why this approach? Why one aim and a number of objectives? This is just one way of doing it. There are other ways of doing it, but this is kind of a way we suggest, as it provides all the necessary information in shortest number of words, succinct manner as possible. It doesn't overcomplicate matters. It keeps it simple, it keeps it straightforward, almost provides you with a framework to write to, and it takes the reader through also in that simple framework so that they can follow your application when they're reading it. And also it gives them a really clear structure to refer back to. So once they've started to read the detail of the research plan, they can quickly refer back to the objectives just to remind them of that overarching objective that you want to do if should they need to, but it's a really, really clear way to follow up and down the application. And you want to structure it in a clear way as possible, because, you know, as we've said lots of times already today, funding boards are reading lots of these applications on a single day. So you want to explain your study in the most simple way possible to get it into the committee's head, and so that they can see what you want to do, even if they're not in your field. So this is why we suggest this way, but you can do it in other ways. So the title, it needs to be descriptive, it needs to be concise, it needs to avoid technical phrases and abbreviations. It shouldn't be particularly long, so you don't want the reader to have to take 3 or 4 breaths to read it. It needs to be a really quick introduction. Don't use complicated terminology. Keep it descriptive, keep it easy for people to read. It's basically for them to remember kind of what the study is about. It needs to capture the essence and be straightforward. So in this example, we've gone for investigating motivational interviewing to improve uptake of pulmonary rehabilitation, a randomized controlled trial. So we've included that bit of a randomized controlled trial. It just gives methodology upfront for the reader to understand, you know, oh, this is what I'm going to be reading about. I'm going to be reading about motivational interviewing in an RCT. And it orientates the reader early on when they read the title. But it's straightforward, it's not complicated. I think it's very easy for people to think, oh, we need to have a really catchy acronym that comes from our title. You don't need one. They're fun if you can make it, if you can find one, but don't spend overly long trying to, create this perfect catchy word that forms from your title. It really isn't necessary. It's just a nice to have. You can have it, but it isn't needed at all. So just to summarize, kind of work on one question or aim, make sure it's watertight, make sure it summarizes your application really, really well. Take time crafting your objectives, and really make sure they lay out how you want to achieve your aim or your research question. And consider your title carefully. It's the face of the application. It's what people are going to read first when they look at applications. Make sure it's easy to read and really summarizes what you want to do. And then here are some references should you want to look at them. So they list the NICE guidelines, the JLA, and also where to find the NIHR funding opportunities, and also the UKRI, but particularly the MRC initiatives.